So moving on to the next question, we have a question saying, "My father is on dialysis and he has a lot of cramps and dizziness. Why is this happening? Is there any way to help him feel better?"
Uh, Good question. Actually, this is probably one of the most common questions that I encounter in practice. And again, and the reasoning is, when we're using dialysis, what we're doing is you need to take care of the dog. Okay, sorry, my apologies. I have a little dog we have to take care of. Okay, so coming back, um, dialysis is something that we use when we're at end stage kidney failure, and we're using dialysis in place of the kidneys. Okay, so in doing the process, what we're doing is we're cleaning the blood, and at the same time, we may not be making as much urine, so therefore we need to remove the fluid, and that's the process in simple sense. Now, sometimes, we prescribe what's called a dry weight, which is the amount of fluid that I'll be removing from the patient. And sometimes, it may be a little too much. Okay, so if I'm pulling a little bit extra fluid from the patient, that can definitely lead to cramps and dizziness and stuff like that. So that could be a potential cause. Now, another reasoning, of course, is we have to look at blood pressures. Um, in general, kidney disease, it comes along with blood pressure issues as well. So we may be on certain medications that lowers the blood pressure. On top of that, we're trying to pull fluid off. It can lead to some of these symptoms as well. So again, this is something that an individual case, we have to kind of look at to see, okay, maybe we need to adjust the medications, or we may need to not pull off as much fluid when we're doing dialysis. But you know, these are definitely symptoms that people experience doing dialysis for sure. Um, what else can we do? There are certain strategies that we use to kind of help mitigate this. For example, we use certain things like tonic water, or sometimes there are certain medications that we sometimes use as well to kind of help through this process.
Mhm. Okay, so do you think there are a few treatments, or can you recommend a few treatments that might help them get through like these phases of dizziness? Maybe
Well,
you can.
well, yes. Again, it's not a generic way to address it, because there's so many factors that can cause this. Like if I'm managing the patient, then there's a lot of things I have to think about. Could there be something going on with the heart? Could they potentially have some heart disease, or what's called congestive heart failure, something like that, where the heart functions a little bit down? That could be triggering some of this. Could it be just related to the amount of fluid that we're taking? Well, that could be a potential thing. Could it be related to the blood pressure medications? That could be. So, it would be difficult for me to just give a generic way to fix it. I think it has to be an individual, uh, where I have to analyze, okay, what exactly is going on, and then come up with the plan.
Uh-huh. And another follow-up would be, is dialysis usually painful?
Oh, that's a good question. Again, this is kind of the fear of the unknown, but there are different strategies that we use for dialysis, or modalities. We do, like, where one would go to a center and they do dialysis. There's another one where we would use peritoneal dialysis, where can you get him up, please? Sorry, guys. So we would use something called peritoneal dialysis, where we're instilling fluid in your abdomen and then removing it. But the whole question is it painful? Well, essentially what we're doing is we use needles, right? We use two needles, one needle to remove blood from our body, and the second needle to return blood back into our system. Okay, so there may be a little bit of pain. Sometimes we do use certain medications, like some lidocaine, to kind of help numb the area so they're not having much pain. But the process itself, it's not painful. It's not painful.
Mm-hmm. And can you stop dialysis after a few treatments? And also, can you have like a normal lifestyle when you're on dialysis? Like, can you work and travel and exercise
Mm.
normally, or are there some changes?
Oh, excellent questions. Excellent questions. And again, I think the ultimate goal here is, in general, in practice throughout the world, is dialysis. We use as a bridge towards the kidney transplant. Dialysis is not something that we typically use for long term, forever per se. And again, each situation is different. But what I would say is, the the goal in general, we have kidney disease, we have end stage kidney disease, kidneys are failed. How are we living? Are we able to do all the things that we need to do? And that's really the goal. So for most of all my patients, what we would do, and again, we will choose the modality. For example, a lot of my patients, they do this dialysis at home. So if they're doing it at home, they have the flexibility to be able to go to work and do. I have patients who are doing what's called peritoneal dialysis, where they are able to travel to different places. So we work along with our patients to maintain a normal life as best as possible. But again, each person's different. Sometimes there are certain complications and symptoms that can arise during dialysis. So, but what I guess the final thought would be is, we're using dialysis as a bridge towards a kidney transplant, and with the transplant, we're able to get back to a normal life.
Mm-hmm. Thank you so much. I think that's like a good deep dive into dialysis. Thank
Mm.
you. Um,
Okay, absolutely.